60 by 60 sign has been described in A. Acute myocardial infarction, B. Aortic dissection, C. Acute pulmonary embolism, D. None of the above. Correct answer C. Acute pulmonary embolism. 60 by 60 sign in acute pulmonary embolism is a pattern detected by Doppler echocardiography indicating a disturbed right ventricular ejection pattern. The sign has two components. One tricuspid regurgitation jet of less than 60 millimeters of mercury, TR velocity less than 3.9 meters per second, and 2. Pulmonary flow acceleration time of less than 60 milliseconds. It may be noted that TR gradient should be above 30 millimeters of mercury to indicate pulmonary hypertension due to pulmonary embolism. High TR gradient may indicate chronic thromboembolic pulmonary hypertension, especially in the presence of right ventricular free wall hypertrophy, suggesting long-standing pulmonary hypertension. Identify the cardiac chamber with filling defect marked by red arrow in the cardiac CT. A. Right atrium, B. Left atrium, C. Right ventricle, D. Left ventricle. Correct answer B. Left atrium. The chamber with filling defect marked by red arrow is just anterior to the spine and is hence the left atrium. Negative shadow is due to the thrombus in the left atrium. Measures to prevent spinal cord ischemia in thoracic endovascular repair of aortic aneurysm. A. Avoiding blockage of left subclavian. B. Surgical graft to left subclavian before TEVAR. C. Pre-procedure drainage of CSF. D. All of the above. Correct answer D. All of the above. Spinal cord ischemia manifesting as paraplegia is one of the important complications of TEVAR. Avoiding blockage of left subclavian, which gives branches which eventually supply the spinal cord, is a preventive option in elective setting. In cases in which left subclavian needs to be overstented, a hybrid procedure with surgical graft to the vessel likely to be blocked being placed before TEVAR is an option. Pre-procedure drainage of cerebrospinal fluid can be useful as it has been proven useful in aortic surgery for protection of spinal cord. CSF drainage is an immediate option for reversal of paraplegia if it does occur unfortunately. Other option is to raise the blood pressure with mean around 90 millimeters of mercury. Episodes of hypotension should be prevented as far as possible to prevent spinal cord ischemia. Typical arrhythmia seen in holiday heart syndrome. A. Ventricular tachycardia, B. Ectopic atrial tachycardia, C. Atrial fibrillation, D. None of the above. Correct answer C. Atrial fibrillation. Holiday heart syndrome is the name given to atrial fibrillation which occurs after binge drinking. The original description was in 1978 by Ettinger and colleagues. That study reported 32 arrhythmic episodes in 24 patients. There was spontaneous recovery with abstinence from alcohol. Carotid-femoral pulse wave velocity increases with A. Age, B. Hypertension, C. Renal failure, D. All of the above. Correct answer D. All of the above. Carotid to femoral pulse wave velocity is taken as the gold standard for measuring aortic stiffness. Pulse wave velocity increases as the arterial wall stiffness increases with age. Other conditions which can increase the arterial wall stiffness are hypertension, diabetes mellitus, and renal failure. The pulse wave velocity is measured from the propagation time for the pulse wave to travel from the carotid to the femoral artery, both being accessible for external measurements. Arterial tonometer can be used to record the waveform, and the propagation time is measured from the foot of the carotid waveform to that of the femoral waveform with reference to the electrocardiogram. In this case, the measurement need not be simultaneous. Alternatively, simultaneous measurement from both carotid and femoral arteries using mechanotransducers can determine the propagation velocity from the peak upstrokes of both tracings. The structure marked with red arrow in the echo image: A. Central venous catheter, B. Chiari network, C. Pacemaker lead, D. None of the above. Correct answer C. Pacemaker lead. Chiari network is seen only in the right atrium. The structure marked is extending across the tricuspid valve into the right ventricle. Central venous catheter tip is usually placed in the superior vena cava. Occasionally, the tip of a central venous catheter placed at bedside without fluoroscopic guidance can be in the right atrium, but it seldom crosses the tricuspid valve into the right ventricle. An implantable defibrillator lead also traverses the tricuspid valve into the right ventricle. The defibrillator lead is much thicker due to the presence of shocking coil in the right ventricle. Windkessel effect is noted in A. aorta, B. coronary arteries, C. cerebral arteries, D. none of the above. Correct answer A. aorta. The term Windkessel effect is used in the setting of large elastic arteries like aorta. The original term Windkessel means air chamber in German language. It was an air chamber used in fire engines in the 18th century to maintain continuous delivery of water for firefighting. In the case of aorta, the aortic elasticity causes expansion and temporary storage of blood in systole so that more blood enters the aorta than what leaves it in systole. This buffer stock of blood is released during diastole to maintain organ perfusion. The Windkessel effect makes aorta function as a second pump in diastole. This diastolic flow is quite important in the case of coronary perfusion, as most of the coronary perfusion is diastolic. As the elasticity decreases with aging, this buffer effect is reduced, leading to an increase in arterial pulse pressure and systolic pressure. Which of the following is not a radiological sign of left atrial enlargement? A. Double atrial shadow, B. knuckle sign, C. Elevated left bronchus, D. Prominent left atrial appendage. Correct answer B. Knuckle sign. Knuckle sign is the abrupt cutoff of a pulmonary artery branch due to pulmonary embolism. Double atrial shadow is the visible left atrial shadow within the cardiac outline near the right heart border. Prominent left atrial appendage is seen as a bulge along the left upper border just below the pulmonary artery segment. The left atrial appendage enlarges along with the body of the left atrium. It will not be seen if the left atrial appendage has been removed earlier, as in case of closed mitral valvotomy, which is seldom performed currently. Elevated left bronchus is seen as a radiolucent outline within the cardiac outline, as the left bronchus is lifted up by an enlarged left atrium. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.